Eating disorders come in every shape, form and size, and gender alike. A lot of times when we think stereotypical eating disorder, we think female, and there's a lot of males that suffer from eating disorders as well. Two specific types. The first one is anorexia nervosa, and that's typically categorized by a desire to be thin, and with that comes pretty extreme calorie restriction. And then there's the second type, which is bulimia nervosa, and bulimia tends to be something where somebody might overeat. They might eat a real excessive amount of calories in a very short amount of time, and then they have to get rid of those calories via some sort of purge. Purging comes in many ways, shapes and forms. A lot of times people think purging as vomiting, and that's the only way. But there's also over-exercise, use of laxatives, diuretics, and things like that. There's many, many reasons. Sometimes it's just for image. It starts off by, I just want to look better, and it becomes kind of an obsession, and then we start getting feedback from the public, and they're like, oh, you look so good, and that makes us want to just continue to go. Sometimes it has to do with control. The one thing that nobody else can have their hand in is what we put in our body. It's really up to us what that looks like, and so it's that one thing that we can really hone in on. Sometimes people really want to numb out their emotions, and one way that we can numb out our emotions is to really focus on a specific something, and in this case a lot of times it's caloric intake, or not wanting to focus on our emotions, and so we consume ourselves with food. The thing that comes to mind the most frequently is if adolescent tends to avoid, and they start to avoid meal times, they start to avoid activities that have to do with food, or they're really just hyper-focused on weight, shape, and size, and they're talking about weight, shape, and size a lot. They're talking about appearance, they're talking about social media that has to do with those things, or if they see kiddos eat a meal and they're running to the bathroom right afterwards, or they're starting to really hole up after a meal, because that could be an indicator of purging behavior. I think anytime a parent has concern, it's a good idea to get a professional opinion on whether or not this is something that's stereotypically normal or something that is of more concern. Once somebody really gets into eating disorder patterns and eating disorder thinking, it's typically a long road of treatment, so the sooner the better. Here at Boys Town, we really work across the board with all of the different disorders, as well as the ones that aren't specifically categorized, both with family and the individual. We assess where they're at, and we assess how severe the eating concern is, and then we may engage in individual therapy with that person. We may include family therapy so we can help family best support them. There's also typically a dietitian that works with the individual, and then there's regular appointments with your medical provider as well, because when somebody is really engaged in an eating disorder, we need to make sure that their internal functioning is just as strong as their mental health functioning.